Okay. Hi there, everybody. It's Ruth Backlund from Energy Works Myofascial Release. I posted this morning that I would do a little follow-up from our Women's Health Seminar today. I want to talk a little bit about self-treatment of the breasts. No, I'm not going to demonstrate on Facebook how to do that. That's a private in-session kind of thing only. But I did want to talk about, what people think for self-care of their breasts. They tend to think about, I need to do a monthly check of my breasts, and when I'm in the shower, I need to have a mammogram every year, or have a physical every year and have the doctor check my breasts. That's really not breast self-care, okay? That's looking for disease. It's not preventing disease, and that's really what I'm going to talk to you about today is to that you would want to self-treat your breasts to prevent disease versus looking for a problem and then having surgery, okay? So that's really what self-care is. And so when people think about it, they think about it in a different way, and I want to really impress upon people that there is a level of prevention that you can do for yourself, and the reason why you would want to do that. So there was a gal at our Women's Health Seminar today that, or actually this past week, who had done a thermography and was really alarmed by the results of her thermography, where it showed a lot of inflammation in her breasts, one more than the other. And she brought her pictures and actually posted them for our fellow therapists to actually see what those pictures look like under thermography. And she gave me permission to share these with you. And so I'll post them on Facebook as well, but I want to show them in this video too of, what that inflammation looks like. And the more inflammation that's in your body is more of a predisposition to, more problems. So, predisposition for disease. And so what she did when she got the results of her thermography is she went through a series of some intensive myofascial release on her breasts, and then had the thermography done again, and really showed the drastic difference in reducing that inflammation in her breasts. So I'm going to try to pull this up here just to show you. So bear with me just a second. It's actually pretty amazing. So I think you can, hopefully that light doesn't give too much reflection. So what you can see here is both breasts actually have a lot of inflammation. The red is a lot of inflammation, and the one side is much worse than the other. And she actually had both of her breasts treated pretty extensively, which is good. And I'm going to scroll this up. So after myofascial release on her breast, her doing self-treatment, that's actually even better. Self-treatment as well as seeing a therapist to get some work done. This is after she had myofascial release on both of her breasts. So look at how that inflammation changed. You can still see there's inflammation in her neck area, underneath the breast or axilla, things like that. But the breast tissue alone looks very, very healthy. So I'm going to flip this back a little bit here. Big difference. Look at that. That's a lot of inflammation. I mean, she just did herself a huge favor in learning how to... Hi, Jody. You're absolutely welcome. Feel free to share anything that I post out here. My job, I'm really trying to just get the message out for people so they learn how to take care of themselves. And that's great stuff. So thanks for the thumbs up there. But anyway, so this is her before MFR from a front view, and this is her after MFR, after several sessions. It wasn't just one. Again, self-treatment and working with a therapist as well. And then this is a side view. This is for, I gotta flip this, I can't read it. This is the, see, try to do something live in front of the camera and hold something at the same time. So I'm gonna try to get this back here. So this is her left breast before, this is her thermography before she had the myofascial release. And this is the left after her myofascial release. I mean, huge difference. Look at that. Look at the difference in inflammation. I mean, it's just so drastic. It's just crazy. And this is on the right side. Right side thermography, lots and lots of inflammation there. And then again, after her series of myofascial release, I mean, that is absolutely amazing what myofascial release can do for your breasts. And the reason why that happens is, if you think about it, a lot of that inflammation, or even if you think of like fibrocystic breasts, those that tend to be really sore and tender, they're noduly. There's a lot of structure and tenderness in the breasts, and especially certain times of the month, if you drink a lot of caffeine, things like that, they can become more inflamed. But really, it's just tightened down fascia. So what happens is, fluid and energy gets trapped in that tissue, and it just gets stuck there and causes swelling, and then it becomes painful. So you don't have to have surgery to have that removed. That's just going to create more scar tissue. But you can do myofascial release, with a therapist or on your own, if you learn how to do that. And there are ways you can self-treat your breasts. So, I mean, it's totally doable. Is that you can open that up, and then the energy and fluid gets to flow again. So then the tissue becomes, loses its inflammation and becomes healthy again. So, like I said, I will post those pictures again, because it is pretty amazing how much it frees up your body. And that's just in the breast tissue. I mean, that could be anywhere in your body, okay? Of how things get inflamed because they're stuck. It's trapped energy, fluid can't flow, blood can't get into where it's supposed to, things back up, and they don't function, and then you get disease, okay? So fibrocystic breast is one situation. Now obviously sometimes people have had, surgery, and maybe they've needed surgery. There's a lot of people with breast reductions, a lot of back and neck issues because their breasts are so large, or the breast implants. People do that as well for, self-esteem issues, or it's a reconstructive type surgery after breast cancer or something like that. Some of those are necessary, absolutely. But are they all necessary? Not all of them are, right? Some are purely cosmetic. People just don't realize what they're doing to their bodies and what that scar tissue is going to cause for them down the road. Tend to have a lot of scar tissue causing back pain, neck pain. They could have, it pulls their head forward because there's more scar tissue, their shoulders round in more forward, and they can have a lot of pain. They can, with the reconstructions, a lot of times they, cut up into the breast and around the nipples so they can replace it. And, all that scar tissue is there, and it can make the nipples even super sensitive, which is really unfortunate. But, that's one of the things that can happen. It doesn't happen to everybody, but it can happen. So if you can avoid those things, great. So if you could, learn how to treat your breasts, reach out to me if you want to learn how to do that. I can definitely teach you. Again, not something I'm going to post on Facebook because that's an intimate situation, but there are a couple of things that you can do to avoid some of that backing up of fluid in your breasts. They're meant to drain. There's a lot of ducts in your breasts that, just like the rest of your body, there's lymphatic drainage areas where your body's meant to cleanse and clear things. So, if you can avoid wearing underwire bras, that is huge, because what that does is it actually cuts off the circulation near the lymph areas of your breasts. So if you can avoid an underwire bra altogether, that is in your best interest. If you can, avoid metal ones, if you can use plastic instead of metal, if you think that's what you have to do, that's a better alternative. We are electromagnetic beings. That's why MRIs work, because we are electromagnetic. And so that metal sometimes can have an effect on how things work in your body as well. Not like a pacemaker or anything like that. It's not like drawing something big, but how magnetic things can affect your body. So metal, directly on your body, all the time in constricted areas could pose some issues. So if you could go for plastic, or if you could just go for just the plastic, the rubberized band instead of having, that the underwire to cut things off. If you can just have the rubber or elastic bands, that's even better for you, because you don't have as much constriction there. So of course, if you have the opportunity to just run free, that's even better. We're not all comfortable with that in, social spaces, but if you're home alone, who cares, right? That's what I do actually when I'm working from home. So yeah, anyway, learned that from my cousin this last summer, and it's actually better for your body. So when I'm not out in public, yeah, I'm taking care of myself in a different way. So anyway, those are just a few things that I wanted to share with you about, self-care for your breasts is really not making sure you're doing mammograms and self-care of your breast to see if you can find a lump. That's really not what self-care is, even though that's what we think about for modern medicine is we're looking for cancer, right? No, you need to learn to take care of your breasts. And it's a different way of taking care of your breasts. It's a different kind of prevention. So if you're interested in finding out how you can do that, you know, I know a gal who's published a book on breast care, and I can also teach you how to do that in my office as well. So if you're interested, you know, feel free to message me, and, you know, we can definitely talk about it and see where we go from there. But anyway, that's what I wanted to share with you today. I will post those pictures right after I post this video. But self-care for your breasts, super important. Again, it's a prevention. It's not looking for a problem. It's just preventing a problem from happening and keeping those tissues healthy. So, all right, that's me signing off. Have a good day.